Hi, good afternoon. For those of you who don't know me, I'm Dr. Austin Feeney, an orthodontist in New Canaan, Connecticut. And this is really just a brief instructional video to show all our patients and parents of the process that we're going to be doing to receive our patients and care for our patients during this COVID-19 pandemic. So first off, we're going to have a greeter come down. The choirs are going to be waiting right out here on the street, on Pine Street. The greeter is going to open the door, and we're gonna point to the car and we'll say, John, you're gonna come in first. So we'll bring John in, the greeter's gonna come. We're gonna come up the stairs here. And right here is really what we call our triage or check-in station. Vilma's here. She will be taking your temperature, another one of the staff. There will be 2 forms that we have to make sure that are filled out. So these were emailed to you. So please have these filled out in advance and either scan and email them and send them back to us, or bring them in with you and have your child or you, when you come in, give it to us. If for any reason you don't have it, we cannot let you enter for the appointment. And the appointment will have to be rescheduled, unfortunately. So Vilma will take the temperature. These will be previously filled out. If not, we'll have the child go back down, make sure the parent fills it out. We'll give you a pen. We don't want the pens back because we don't want any contaminants on the pen, so you take the pen with you. So once we've taken your temperature, it's 100 degrees Fahrenheit or less, and we have the 2 forms. Then we walk into the office. Just before you go in, Vilma's gonna put some hand sanitizer right on your hands, give you a couple of... So all patients are gonna sanitize their hands before they come in. And then we're gonna walk the patient in. Now, in some instances where the parents require that they come, let's say your child's 8 or 9 years old, they're not comfortable coming up by themselves, and the parents feel there's a need to come in, they're certainly welcome, but we're trying to limit any parents because we just don't want people gathering in the waiting room. It's not that we don't want you, but really the CDC and OSHA guidelines are such that they really want to limit any gathering. So we're only going to have 1, 2, 3, 4 chairs for anybody to come into the waiting room. Unfortunately, there are not going to be anybody other than the patients allowed back in the clinic area. So this is really our gate where nobody can come other than the patient. So any parents that come in, you'll sit here. Now, when your child's dismissed, we're going to walk them out the back, but the parents, since they can't come through here, they're going to have to exit this door. But we're going to have to do it in concert because we really are supposed to have just a one-way flow. And if you come into the waiting room, we can't have you walking through the clinic. So you'll have to exit here, but we may have to have a traffic cop, so to speak, to direct the traffic so you're not bumping into oncoming patients. So we'll walk right on in. So the patients walked in, and one of the assistants, we have the lovely Savannah here today. We're gonna give you an oral rinse. So Savannah will dispense that. You'll take it in your mouth, you'll rinse for 30 seconds and spit it out here. And you're not gonna turn the water on or anything because that's something that we do later on. Then we're gonna escort you over to the treatment chair. So here you'll be seated, and the assistant will, again, it'll be like Savannah or Vilma or Jovi. They'll have a full gown on, a mask and gloves. They'll have a face shield. We're not really gonna rinse, so we wanna make sure that in advance you've brushed, you've flossed, and that all your teeth are clean, because if there's more bacteria on your teeth and your gums, that just contributes to greater transmission of the virus. And we wanna minimize bacteria in the mouth, any kind of bacterial virus. So by brushing, flossing at home, coming in here, doing the oral disinfectant rinse, we'll bring in here, take the wires out. We can't clean your teeth here. We can't be cleaning food out. If we find that there's too much debris in your mouth, we're going to end up rescheduling you because, you know, we have to follow these very strict guidelines, and those guidelines are super important for not only your safety, but for your families, our staff's families, myself as a doctor. So super, super important that all these protocols, and that's part of the reason why we're doing this videotape, why we're sending emails and trying to give everybody the instructions that are necessary to keep us all safe, healthy, and well. So the assistant will come, they'll take your ties out, take your wires. Dr. Feeney will come over, give the assistant some instructions just as we do normally, and Dr. Feeney being me, of course. So, and I'll have a mask and gloves and gown and a face shield and glasses, and we'll render the treatment. Then what will happen as we're finishing up, we're actually going to all have walkie-talkies. So we will radio the front desk, who will contact the parent down in the car, and they're going to say, okay, John is done with his visit, and what will happen is we're going to want to make your next appointment before John really leaves this chair. So, and that's one thing I got a little bit ahead of myself on, but when I first check the patient to decide what we're going to do, I'm going to call the front desk and have them call down to the parents waiting, and they're going to make the appointment while we're working on the patient. And then when we're done with the patient, we will call the parent again and say, all right, we're done. Dr. Feeney got everything done. You already have your appointment for next week, so please expect John. So we dismiss John. We're going to walk him out here. The assistant is going to walk the patient out. So we follow these arrows. We're going to walk out this door here. So we come out here, and then you're going to exit back through. You're going to come back this way. These doors will be open. They're not going to be closed. These are fire doors, so they have to stay closed, but we're going to make sure they're open so that none of the patients have to touch anything with their hands. So when we go downstairs, the parent can meet the patient at the door, and they can then get in the car and they can finish their appointment, and that pretty much concludes it. Now, from what I said today, it may change a little bit, it may vary, so there's no playbook for this. This is all new for us, so bear with us, and again, your health, your safety are of utmost importance, and that's the reason we're doing this, and that's the reason we're only seeing X number of patients per hour. We have to disinfect each chair. We have to wipe all our surfaces, our door handles, our countertops, everything. So after each patient, everything gets wiped and sprayed. We have all these disinfectants and cleaners that are strictly approved by the CDC and OSHA that we're using. So rest assured, everything that we're doing is to ensure the health and safety of you or your child. So I want to thank you for your patience, and also for the privilege of serving you and your families. And we only wish that we can all get through this pandemic safely and without anybody getting ill. And we look forward to welcoming everybody back, and I can't wait to see you all. Thank you very much.